For the best in eyewear, call Dr. Leeks Optometry.
Most of the original time to treatment studies were looking at individual aspects of care. So what was the time from diagnosis to first treatment? What was the time between the different treatments? But we haven't found any studies that looked at what was the time from diagnosis to completion of all treatment.
Dr. Deborah Pratt is a breast specialist with Cleveland Clinic and the lead author on this study. She says they looked at more than 28,000 breast cancer patients who had surgery, chemotherapy, and radiation as part of their treatment. And they discovered that if all three were completed in less than 38 weeks, there was a higher 5-year survival rate. However, if it took longer than that, it did affect their survival. Dr. Pratt says this information builds on previous research noting poorer outcomes when there was a delay in starting treatment. It also emphasizes the need to identify why treatment in some cases is delayed.
Another interesting aspect of the cutoff is that cutoff was good for no matter what type of breast cancer you had. So if you had different receptor patterns of your breast cancer, it didn't make any difference. So we should not triage patients based on their different types of cancers because every patient can have an effect on their outcome if we're taking too long.
Dr. Pratt says when it comes to detection, women should be regularly doing self-breast exams at home. Mammograms are also recommended for women over the age of 40, whether they have a family history of breast cancer or not.